1. It is appropriate for a registered nurse to delegate medication administration to an unlicensed assistive personnel, UAP. True or false? Answer: false. Rationale: UAPs are not authorized to administer medications, as it falls outside their scope of practice. This responsibility remains with licensed nurses to ensure safe and appropriate medication administration, per NCLEX-PN delegation guidelines. 2. The nurse should prioritize care for a patient with chest pain over a patient awaiting routine dressing change. True or false? Answer: true. Rationale: chest pain may indicate a life-threatening condition, e.g., myocardial infarction, requiring immediate assessment and intervention, prioritizing it over routine tasks like dressing changes, per ANA prioritization principles. 3. A nurse can share a patient's medical information with family members without consent. True or false? Answer: false. Rationale: sharing medical information without patient consent violates HIPAA and patient confidentiality rights, except in specific circumstances, e.g., legal guardian, per federal privacy regulations. 4. Informed consent is required for all invasive procedures. True or false? Answer: true. Rationale: informed consent is a legal and ethical requirement for invasive procedures, ensuring patients understand risks, benefits, and alternatives, per the Joint Commission standards. 5. A nurse can delegate vital sign monitoring to a UAP for a stable patient. True or false? Answer: true. Rationale: vital sign monitoring for stable patients is within the UAP scope of practice, provided the nurse ensures proper training and supervision, per NCLEX-PN delegation guidelines. 6. The nurse should report a medication error to the charge nurse immediately. True or false? Answer: true. Rationale: immediate reporting of medication errors promotes patient safety, allows for timely intervention, and supports quality improvement, per the Joint Commission safety standards. 7. A nurse can refuse to care for a patient due to personal beliefs. True or false? Answer: false. Rationale: nurses must provide care without discrimination, except in cases where personal beliefs pose a risk to patient safety, requiring reassignment, per ANA Code of Ethics. 8. The nurse should advocate for a patient's right to refuse treatment. True or false? Answer: true. Rationale: advocacy includes supporting a patient's autonomy to refuse treatment, provided they are informed and competent, per ANA ethical principles. 9. A licensed practical nurse, LPN, can assess a patient's response to a new medication. True or false? Answer: false. Rationale: initial patient assessments, including responses to new medications, are within the RN scope of practice, not the LPN's, per NCLEX-PN scope of practice guidelines. 10. The nurse should include the physical therapist in discharge planning for a patient with mobility issues. True or false? Answer: true. Rationale: interdisciplinary collaboration with physical therapists ensures comprehensive discharge planning, addressing mobility needs for safe transitions, per the Joint Commission standards. 11. A nurse can delegate blood glucose monitoring to a UAP for a diabetic patient. True or false? Answer: true. Rationale: blood glucose monitoring is within the UAP's scope if properly trained, with the nurse responsible for interpreting results and intervening, per NCLEX-PN delegation guidelines. 12. The nurse should obtain informed consent for a surgical procedure. True or false? Answer: false. Rationale: obtaining informed consent is the responsibility of the provider performing the procedure, not the nurse, who may witness or verify consent, per the Joint Commission standards. 13. A nurse can override a patient's advance directive in an emergency. True or false? Answer: false. Rationale: advance directives must be honored unless legally overridden, e.g., court order. Emergency care follows directives if known, per ANA ethical guidelines. 14. The nurse should document all patient care activities accurately and promptly. True or false? Answer: true. Rationale: accurate and timely documentation ensures continuity of care, legal compliance, and quality improvement, per the Joint Commission documentation standards. 15. A UAP can assist with sterile wound dressing changes. True or false? Answer: false. Rationale: Sterile procedures like wound dressing changes require sterile technique and are outside the UAP's scope, reserved for licensed nurses, per NCLEX-PN delegation guidelines. 16. The nurse should prioritize a patient with a new onset of confusion over a patient with a scheduled medication. True or false? Answer: true. Rationale: new onset confusion may indicate a serious condition, e.g., hypoxia, stroke, requiring immediate assessment over routine medication administration, per ANA prioritization principles. 17. A nurse can share patient information with another nurse during a shift change. True or false? Answer: true. Rationale: sharing patient information during shift changes is necessary for continuity of care, provided it occurs in a private setting to maintain confidentiality, per HIPAA regulations. 18. The nurse should delegate patient teaching to a UAP. True or false? Answer: false. Rationale: patient teaching requires clinical judgment and is within the RN's scope, not the UAP's, per NCLEX-PN delegation guidelines. 19. A nurse must report suspected elder abuse to the appropriate authorities. True or false? Answer: true. Rationale: nurses are mandated reporters and must report suspected elder abuse to protect vulnerable patients, per state and federal laws. 20. The nurse should ensure a patient understands the risks of a procedure before signing consent. True or false? Answer: true. Rationale: nurses advocate for informed consent by ensuring patients understand procedures, clarifying questions, and verifying comprehension, per ANA ethical standards. 21. A UAP can perform an initial patient assessment upon admission. True or false? Answer: false. Rationale: initial patient assessments require clinical judgment and are within the RN's scope, not the UAP's, per NCLEX-PN scope of practice guidelines. 22. The nurse should collaborate with a case manager to coordinate post-discharge services. True or false? Answer: true. Rationale: collaboration with case managers ensures seamless discharge planning and access to post-discharge services, promoting continuity of care, per the Joint Commission standards. 23. A nurse can administer a medication without verifying the patient's identity. True or false? Answer: false. Rationale: verifying patient identity is a critical safety step to prevent medication errors, per the Joint Commission's 2 identifier rule. 24. The nurse should prioritize a patient with a fever of 104 degrees Fahrenheit over a patient with a scheduled physical therapy session. True or false? Answer: true. Rationale: a fever of 104 degrees Fahrenheit indicates a potential infection or emergency, requiring immediate assessment over routine therapy, per ANA prioritization principles. 25. A nurse can delegate catheter insertion to a UAP. True or false? Answer: false. Rationale: catheter insertion is an invasive procedure requiring sterile technique and clinical judgment, reserved for licensed nurses, per NCLEX-PN delegation guidelines. 26. The nurse should use a standardized handoff tool during shift changes. True or false? Answer: true. Rationale: standardized handoff tools, e.g., SBER, improve communication, reduce errors, and ensure continuity of care, per the Joint Commission safety standards. 27. A nurse can ignore a patient's cultural preferences when planning care. True or false? Answer: false. Rationale: respecting cultural preferences is part of patient-centered care, promoting trust and adherence, per ANA cultural competence standards. 28. The nurse should report a near-miss incident to improve patient safety. True or false? Answer: true. Rationale: reporting near-miss incidents supports quality improvement by identifying risks and preventing future errors, per the Joint Commission safety protocols. 29. A UAP can reposition a patient with a pressure ulcer. True or false? Answer: true. Rationale: repositioning patients to prevent pressure ulcers is within the UAP's scope, provided they are trained and supervised, per NCLEX-PN delegation guidelines. 30. The nurse should obtain a verbal order from a physician in an emergency. True or false? Answer: true. Rationale: verbal orders are acceptable in emergencies to expedite care, but must be documented and signed later, per the Joint Commission standards. 31. A nurse can delegate the evaluation of a patient's pain to an LPN. True or false? Answer: false. Rationale: pain evaluation requires clinical judgment and is within the RN scope, though LPNs can report observations per NCLEX-PN scope of practice guidelines. 32. The nurse should ensure a safe environment by removing fall hazards. True or false? Answer: true. Rationale: maintaining a safe environment, including removing fall hazards, is a nursing responsibility to prevent injuries per the Joint Commission safety standards. 33. A nurse can disclose patient information to law enforcement without a court order. True or false? Answer: false. Rationale: disclosing patient information to law enforcement requires a court order or patient consent, except in specific cases, e.g., mandatory reporting, per HIPAA regulations. 34. The nurse should include the social worker in the care plan for a patient with housing instability. True or false? Answer: true. Rationale: social workers address social determinants like housing, ensuring holistic care and discharge planning per the Joint Commission interdisciplinary standards. 35. A UAP can assist with feeding a patient who is at risk for aspiration. True or false? Answer: true. Rationale: UAPs can assist with feeding if trained to recognize aspiration risks and supervised, with the nurse monitoring swallowing per NCLEX-PN delegation guidelines. 36. The nurse should prioritize a patient with a new wound dehiscence over a patient with a scheduled diagnostic test. True or false? Answer: true. Rationale: wound dehiscence is a surgical emergency requiring immediate intervention, prioritizing it over routine tests per ANA prioritization principles. 37. A nurse can administer a medication based on a standing order without assessing the patient. True or false? Answer: false. Rationale: nurses must assess the patient's condition before administering medications, even with standing orders, to ensure safety per ANA standards of practice. 38. The nurse should advocate for a patient's right to access their medical records. True or false? Answer: true. Rationale: patients have a legal right to access their medical records, and nurses advocate for this right per HIPAA and ANA ethical guidelines. 39. A UAP can change a patient's oxygen flow rate. True or false? Answer: false. Rationale: adjusting oxygen flow rates requires clinical judgment and is outside the UAP's scope, reserved for licensed nurses per NCLEX-PN delegation guidelines. 40. The nurse should verify a patient's code status before initiating CPR. True or false? Answer: true. Rationale: verifying code status ensures respect for patient wishes, e.g., DNR orders, preventing inappropriate resuscitation per ANA ethical standards.